watching as somebody's life is slipping away, being somewhat limited on what we can do and with the equipment and training that we have to that point. And we can't help but think to ourselves as we're doing our best effort to try to save a life with our limited training and equipment. Gosh, if there was only someone here with more equipment, more training. Well, now these deputies here that come from various agencies scattered throughout the sheriff's office won't have to think that way. They won't have to be in that situation, as because of the advanced training that they've gotten at the hands of our partners and the equipment that was purchased for us by the Bexar County Sheriff's Foundation, we're pleased to announce that these deputies will be hitting the streets as soon as tomorrow with their new training and equipment, and just get to the business of saving lives, which is what, as first responders at the Sheriff's Office, they already do exceedingly well, but this brings it to a whole other level. So without further ado, I'd like to go ahead and bring up Dr. Brian Everett to talk a little bit more about his aspect on this.
Yeah, thank you, Sheriff. So as a medical director, as an EMS physician, there is nothing that I want more than to have a specialized person trained in there and providing care from that time that person gets injured to the time they can arrive at the hospital and get definitive care. If I can shorten that time in any way possible, we have the opportunity to save a life. These men and women around me are going to save lives. The personnel, the citizens of Bexar County are in a better position today than they were yesterday. We are going to do amazing things. These guys are dedicated to doing advanced medical procedures that have been shown to lead to better outcomes for patients. We're still going to be using our EMS personnel, but they are bridging that gap where we typically don't have anyone there. They're going to decrease that time to that care, and the people outside are going to do much better because of it. And I can't thank these men and women enough for putting in the time, the effort, and the dedication to lead this role. So we're going to see lives saved because of this today. Thanks.
Esta tarde nos da mucho gusto anunciar un nuevo esfuerzo en el departamento del condado, del sheriff del condado Bexar. Nosotros tenemos varios oficiales que ya tienen ellos varios años de ser oficiales de la ley, pero ahora tienen un nuevo trabajo. Ellos, aparte de su trabajo en patrulla, en el equipo SWAT, en el equipo de antifugitivos, ellos ya están entrenados cómo ser médicos. Ellos tienen el entrenamiento, las licencias y luego ya las herramientas para seguir salvando vidas cuando están en patrulla. Nosotros como oficiales de la ley nos frustra la situación cuando llegamos a un incidente, un choque, un tiroteo, donde quisiéramos salvar vida, pero no tenemos los entrenamientos y las herramientas para hacer eso. Tenemos que esperar mucho tiempo para los médicos, pero ahora con estas herramientas, este nuevo equipo de oficiales médicos, ya ellos pueden empezar a salvar esas vidas. Nosotros tenemos varios socios en este esfuerzo, los bomberos de ESD-10, el jefe de bomberos Bobby Hogan, y también el Dr. Brian Everett del Centro Médico de UT Health San Antonio. Nosotros nos da mucho gusto poder decirles gracias a ellos por entrenarnos a nuestros oficiales. Ahora tenemos 9 oficiales que están a diferentes niveles, pero todos a lo mínimo son médicos básicos. Entonces, para nosotros nos da mucho gusto poder anunciar este esfuerzo. Any questions for us?
No, I think we're good.
Okay, good deal. Thank you so much. So, if we can at this point, we've actually got a practical problem set up where some of our deputies can actually show what their training consists of and some of the skills that they'll be employing on the streets.
Real quick,
yes, sir.
Is it okay if I ask an unrelated question? It's about an incident that happened about a horse being found.
Let's do it after this, if that's okay. Yeah, after
Okay.
this.
Cool.
If we can move over.
so tell me when you guys are ready. All right, so we're gonna do a demonstration of what these, our deputies are capable of doing today in the field. So we've had a patient that's had a traumatic injury, and they are not responding to us. Now 911's been called, EMS has been dispatched, the fire department's been dispatched, but one of our deputies happens to be in the area closer to the patient. So they arrive on scene, and they're going to check the patient.
Are you okay, sir? Sir, are you okay?
And realize he's not breathing, he's not responding, he needs CPR. So we're going to start CPR immediately with this patient. Soon after, another deputy arrives, and he has an AED. This is a specialized piece of equipment that's currently not available to many patients until they have a fire truck or ambulance arrive on scene. We are decreasing that time that AED arrives on scene. So the deputy's going to take the AED, place the pads. We currently see that it can take up to 11 minutes for EMS to arrive on scene for a patient. This patient has now had a shock advised, a shock delivered, the time that normally a EMS unit would be responding.
Deliver shock now. Press the orange button now. Shock delivered. Paused. Begin CPR.
Another deputy can arrive and then perform specialized procedures that we have available to us. So right now we're giving breaths to the patient, and we are also able to put a needle into the chest to relieve any kind of tension that may be causing that patient's heart to stop.
Needles in.
And within just a few minutes, we've already done most of what EMS would do for this patient before they've even arrived. So this patient has a better chance of survival because of the time that we're able to get there and provide advanced medical care. All right, any questions? Cool.
Good job, guys. Thank you.
Thanks.
Good job. Thank you very much.
All right. There are all the stuff stuck on me.
Yeah, I knew some of that trump's yours.
Thank God.
If he calls in sick, pen? Yeah. Right. So this is called the Spear, North American Rescue. It is a device that we utilize to diminish an injury such as a tension with thorax or air in the chest. It's a very large needle. It's placed anatomically on the side of the chest wall, inserted. It allows air to escape the chest wall, giving a better chance of survival for the patient. So, pretty big. Yep. No problem. Did you want to try it real quick? Or?
All right, James. All right. Are we good? Pat?
Yeah.
Okay. Everything. Your case is. Oh, actual brown case. know if they put it back in your bag.
No, not gonna. Back over there. We can't. I got the gear.
Freaking SA flyer, dude.
Where's the bottom of the bag?
Was the name flat? Little pink sand bucket. Might have been a crack in it, and I just running loads of water out to it. I didn't want to do too much water, but I gave enough water to it. And I think it's maybe a little more safe and conservative 30 minutes to get to the just to get him to stand up. That's great.
Saving human lives, saving horse lives, equine lives.
Yes, but I usually sing before.
Let's try to figure it out.
We're going to San Diego. Did you see it? Did you find your bag?
My bag and my AD right here.
Back in your bag?
That one?
Is that the one that was needed?
That may be his.
Okay, so who was trying to put this? I don't know. I think it was Casey. Ask Casey what was her. Casey, what?
Redmond took out the bleeder bag.